Hello, good afternoon. There's been a major breakthrough in the fight against coronavirus. For the first time, a drug has been shown to cut the risk of dying from COVID-19. Trials showed that dexamethasone, a cheap and widely available steroid, reduced the risk of death by a third amongst patients on a ventilator. And for those on oxygen, it cut deaths by a fifth. Well, researchers believe it could have saved 5,000 lives if it had been used in the UK from the start of the pandemic. Well, Peter Horby is Professor of Emerging Infectious Diseases in the Nuffield Department of Medicine at Oxford University, which conducted the research into that drug. And my colleague Simon McCoy spoke to him earlier as he travelled in a black cab to Downing Street.
I'm as delighted as anybody. It's fantastic. We've been running this trial for quite some time, for 3 months, and it's fantastic to have some good news. This is a drug that's very affordable, it's widely available, and we've shown that it can have a good impact on improving survival in quite a large proportion of hospitalised patients.
And more specifically, patients who are on ventilators?
Well, it's broader than that. Actually, we showed a benefit in patients who required oxygen on the ward, with about a 20% reduction in the risk of dying, as well as a reduction in the rate of death in those on mechanical ventilation. And that was an even bigger reduction. That was a 35% reduction in the risk of death.
35%. I mean, yes, it's not a vaccine, but this is hugely significant.
No, it is. We were surprised by the result. We were obviously hopeful that the drug would have a benefit, which is why we trialled it. But we were quite staggered by the size of the benefit. So it's really fantastic news.
And as you say, we're not talking about an expensive drug.
No, the whole treatment course in the UK is about £5. So on intensive care, you treat 8 people to save 1 life. So we're talking a very small amount of money to save a life. And that's great, particularly in overseas countries, low-income countries, where this drug is even cheaper.
And in terms of the other drugs, we are familiar with some that we've been talking about. Hydroxychloroquine, of course, is one that we've been talking about a long time. Remdesivir, but this is different.
Yeah, I think this changes the game in a sense because it's widely available. It's been used for over 60 years. It's on the WHO essential medicines list. It's available in every country, and it costs pounds. And in India, it costs less than £1 for a treatment course, probably. So it really is something that could be available for all.
Is it something that those with milder symptoms would benefit from in any way?
Well, we did not see a benefit in those who didn't require oxygen on the ward. So this is not a drug for people at home or outpatients or people who haven't got any respiratory disease.
I'm just looking at a tweet from Professor Chris Whitty, who says this is the most important trial result for COVID-19 so far. Significant reduction in mortality in those requiring oxygen. Safe and well-known drug. Many thanks to those who took part and made it happen. It will save lives around the world. Well, you don't get better praise than that.
No, you don't. And, I'm very pleased to take it on behalf of an enormous team that have made this happen. They've been working night and day for 3 months now, and it's really great to see a positive result. And thanks to all the patients that agreed to be in the trial.
Professor, is there a sort of a eureka moment where you are confronted with data and you suddenly realise just how big a deal this is?
Yeah, it can take a little while to sink in. It's not absolutely immediate, but it took us, we had to sort of sort through the data and look at the different effects in different subgroups. But, within a day or two, it started to become very clear that we were onto something really important.
I mean, the bottom line is, from today, around the world, this discovery is going to save many lives.
Yes, I believe it will. It's incredible. If you look at, we were looking at the numbers this morning, 30,000 in hospital deaths in the UK. The effect we're seeing with this drug would have reduced that by around 5,000 deaths just in the UK.
So that's Professor Peter Horby speaking to Simon earlier, and he, as you saw in the back of the cab there, he's on his way to Downing Street because he's going to be joining the Prime Minister and the Chief Scientific Officer, Patrick Vallance, at Downing Street for the 5 o'clock briefing coming up. And of course, we'll bring you that live. And let's discuss this exciting development now with Professor Carol Sikora, who's an oncologist and Professor of Medicine at the University of Buckingham. Have you been surprised by these results?
I have, but delighted. This is a very ambitious trial. It's British. It's 175 NHS hospitals were involved. It looked at 6 different approaches, including hydroxychloroquine, Mr. Trump's favourite. And rather surprisingly, dexamethasone, cheap as chips in every hospital pharmacy around the world. The drug was around when I was a medical student, so it is a very old drug, I can tell you. And I'm really delighted with the results. They do look very significant. The trial was stopped early because of the significance of the results. And the results can be interpreted now, they can be implemented, the change can be implemented tonight all around the world. I think fantastic opportunity to show how collaboration like this produces significant health gain.
And just to explain it in sort of layman's terms how it works, it reduces inflammation, is that the core of it?
That's the core of it. We know steroids do that. You know, whenever I have a tricky medical situation where there's inflammatory change going in the body, whether it's infection or cancer, one way out, if you're in a crisis, to give a big dose of steroids. And what's perhaps surprising here is this tiny little virus irritates the lining of the little air sacs in the lung. And in some patients, it just fizzles out. But in others, it causes what we call a cytokine storm. We get all sorts of inflammatory mediators, cells go there, and they reduce the transfer of oxygen. And you get this happy hypoxia, as we call it, where the blood oxygen drops and there's nothing you can do except move to oxygenation, ventilation, and maybe bypassing with a machine that pumps oxygen into the blood. And the mortality goes up and up as we do these things. Anything you can do to stop the deterioration of lung function, that's simple, just 6 milligrams, a very standard dose of dexamethasone per day, seems to have quite a massive effect. And as I said earlier, this drug is dirt cheap. It's very cheap, especially in the developing world.
And of course, we're still waiting and hoping that there will be a vaccine against coronavirus. But in the meantime, this and maybe other ways of treating the disease, absolutely crucial and life-saving.
You know, it shows the power of clinical trials and the fact that this had to be stopped because the Data Monitoring Committee, all trials have one to see, showed that the arm that was getting the dexamethasone was doing so much better than those that weren't. So ethically, you have to stop it, especially when we know the drug side effects for years. And, you know, it's a short-term course, 10 days of it. That's all that's given. You don't need to go on afterwards. So the cost was estimated at £35 per life saved. It's probably actually less than that if you take the drug, which is generic, being sold in the third world, where drug prices are much lower, often made locally. And I think it's just fantastic.
And it's strange, isn't it? When you have a new disease like this, it's so challenging to try and come to terms with it. And yet one of the solutions, it's been there all along. As you said, this is a drug that's been around for decades and decades.
I know, steroids are a marvelous thing. I've used them to keep cancer patients going so they can get to their daughter's wedding, giving them a large slug of steroids. And I sort of, at the back of my mind, wondered why it wasn't being used in intensive care units. The earlier studies were less promising, but this is pretty convincing. I've looked at the data this afternoon. It looked convincing to me. And although steroids of different schedules have been used in COVID, this suggests that at the right time and the right place, it can reduce the mortality, and that's just fantastic.
Yeah, really exciting. Professor Karol Sikora, thank you so much for talking to us. Thank you.